Good evening, everybody, and welcome. We have a fantastic panel today to discuss a very special topic: India and COVID-19 second wave. We are really privileged to have the people that we have today on our panel. We have our Consul General of India in Toronto, Apurva Srivastavaji, who will be giving us a keynote speech. She is a little, as you might appreciate, she's got a lot of things on her hand, but she's made time to come and meet with us. So she will be there for the first half of our event. And if possible, we've asked her to try to see if she can stay, but she would be, giving us a little perspective of from her viewpoint, the situation in India, the Indian government's view on what is happening, and how we as Indo-Canadians can help. Also on the panel are some eminent Indo-Canadians. Saronia Sekhar, I probably just said she's not representing Indo-Canadians, but I just probably extrapolated a little bit there. But she's representing the Canadian Red Cross, and she nods her head, so she's probably Indo-Canadian as well. We have Ramesh Chotai. All of us in the Indo-Canadian community know Ramesh Bhai. Ramesh Bhai is a community leader, runs Vraj Community Services, and also the CEO and founder of Bromed Pharmaceuticals. We also have Madhukar Pai, professor at McGill University, and has recently been writing a series of articles in the Globe and Mail and as well the Forbes magazine. So it's a privilege and honor to have you, Madhu, as he likes to be called, at today's event. We also have Kanchan Kumar of TIE Toronto and Remitter, CEO of Remitter. Kanchan Kumar, like Ramesh Bhai, has been putting together a community effort to buy oxygen concentrators and ship them to India. And Kanchan, I think, has some good news. Some of his oxygen concentrators have made it to India already, and he'll give us more details. And last but not least, we have Ananya Tina Banerjee from University of Toronto. And Ananya has also been, writing articles, an expert on the subject, and somebody that we definitely would like to tap into from an academic and from a scientific standpoint on things that are happening in India and how we can help. So next, we would like to move to a little bit about myself. My name is Vijay Thomas. I am the president of Indo-Canada Chamber of Commerce. In my day job, I run a software company, and it's my honor and privilege again to be a moderator. And we hope to, talk about this very important topic today, and throw light, especially to the 1.6 million Indo-Canadians, and how we connect to our 1.3 billion, counterparts in India, and how can we really help. We all agree it is a serious situation. That is why we're all talking about this. It is a situation that needs our attention, but it is something that I think we need to do in the right manner, and that's why we have all of you here. So we also, I'd like to mention that we might have a special guest today. We are expecting Minister Anita Anand, and I think Minister Anita Anand has made it in here. So we will actually, get Minister Anita Anand. Before we start with Minister Anand, we will talk. We want to just talk about a little bit. Let's moving on. A little disclaimer: the information provided, webinars conducted by ICCC for general information purposes, does not constitute legal or professional advice. I'll leave you guys to read the middle paragraph. The last one there is kind of important. The views expressed speakers are their own personal opinion, do not necessarily reflect the official policy or position of the ICCC. So with that out of the way, as I like to say, none of you can sue us. That's done. And what are we going to be talking about today? The big thing that we want to talk about is not what happened, what went wrong, what is, how could this have been prevented. We want to talk about Canada, India, the COVID camaraderie, and especially, I think, I want to touch upon a couple of things. If you look at the screen, this kind of encapsulates, what we want to talk about today. a couple of weeks back, a couple of months back, we actually had Minister Anand on our show. And a day before that, Prime Minister Trudeau spoke to Prime Minister Modi, and we got confirmation that India would send Canada some 2 million vaccine doses. And today, I mean, a couple of days after, Canada has given aid to India. I think this shows the camaraderie, the friendship between the two countries, two large democracies, two fairly important companies, important countries that are working together. So it is I think something that we wanted to really hit upon, because I think there's been a lot of talk about how something can be perceived as weakness. I think between friends, if we ask for help and we receive help, or we give help, I don't think it has to be perceived in any shape or form. And as the Indo-Canada Chamber of Commerce, we want to very vehemently and assertively say that we are not, we definitely want both countries to work together, help each other, and I don't think any of this has to be perceived in any different way. So if you look at that, we've got Minister Anand, retweeting what Ajay Bisaria, the High Commissioner of India, tweeted. Ajay Bisaria ji tweeting something that the Canadian High Commissioner in India tweeted. We also see on the right side, right at on the extreme right, a very great event that happened. Niagara Parks changed their colors to the Indian tricolor yesterday. So it was orange, white, and green yesterday evening. So this is something that we truly think embraces Canadianness. Canadians, I think, as a community as a whole, feel for what's happening in India and definitely want to help out. So, and definitely, I don't think, and that's how I think the Indo-Canadian community, Indo-Canada Chamber of Commerce as well wants to play in that place. And today, with that out of the way, so to set the tone of what we want to speak about, I'd like to call Minister Anand. If you want to just move on to the page about Minister Anand, please. Okay, we have a little bit, sorry, we've got a little bit, just a little more tone. Sorry, I forgot. We've got a little speech from the Prime Minister, before we go to Minister Anand. So a little bit from Prime Minister Trudeau to set the tone a little further.
We've all seen the heartbreaking news from hospitals in India that are unable to keep up with the number of patients. Earlier today, Minister Garneau spoke with his Indian counterpart about how Canada can best help, including through the donation of extra medical supplies. We're also ready to provide $10 million through the Canadian Red Cross to the Indian Red Cross. This will support everything from ambulance services to buying more PPE locally. If you want to donate to the emergency efforts on the ground, go to redcross.ca.
So thank you very much. With that, we'd like to move to moving on a little bit. We'll come to Apurva later. Anita, the Honorable Anita Anand, Minister in the Federal Cabinet. Anita ji,
hi.
Thank you very much for making time for us. And I know you've got only a little time, so we'll slot you in right away, and we'd like to hear something from you.
Well, thank you so much. I really appreciate being here today with you. And hello to all of the ICCC members, and namaste. I wanted just to reiterate that throughout this pandemic, and especially in the last few months, Canada and India have grown closer. In particular, we signed a deal with the Serum Institute for 2 million doses of the Covishield vaccine. The first 500,000 doses arrived in March, and we have been in touch with the Serum Institute. We do expect to receive the 1.5 million doses once India is through the most difficult part of this pandemic that it is experiencing, and which is very much on all of our minds. We all have relatives and friends in India that are experiencing this very hardship. So I will move to talk a little bit about that. You've heard that our Prime Minister announced $10 million of support through the Red Cross for India. And in addition, I've been working behind the scenes with Minister Garneau and Minister Gould and Minister Haidu to determine what supplies and other equipment might be useful for India. So we will have more to say about that in the coming days. But let me be clear that Canadians are across this country concerned about what is happening in India. And we here at ICCC, and my family included, are no exception. So it will be made more clear over the coming days what the additional help that Canada will provide is going to be. But we remain steadfast in our support to India and the people of India, as well as all of their relatives and family in Canada who are experiencing so much worry, concern, hardship, and indeed loss of life that is so troubling and so upsetting. So I just wanted to come forward today to say hello, of course, but to tell you that we are working very hard for India and we stand with India. Thank you so much for having me here.
Thank you very much, Minister Anand. We really appreciate you making time. That really, I think is something that we at the Indo-Canada Chamber of Commerce really appreciate you making time. So thank you very much. And, if you can stay, you're more than welcome. But I know you've got, more things to do. And as Canadians, if you can go and do more for us, we would, I think, really understand that and appreciate it. So we wish you all the best from the ICCC for everything that you've been doing to keep us safe, and we wish you all the best.
Wish you the best too, and I'll be back again and we can talk about vaccines and vaccine procurement as well.
Thank you, Anitaji.
Bye-bye.
Yeah, with that, we'll move to our keynote speaker today is our very own Apurva Srivastaji. Apurva ji is somebody that we all know very well in the Indo-Canadian community. We all, have met her so many times. She's somebody that comes across as the really friendly face, somebody that's really been able to embody some of the core values of Indian hospitality, Indian culture, and she's been steadfast, in the Indian community here with all her support. So Apurva ji, over to you, and if you can, probably address, you probably already know the concerns, the questions that Indo-Canadians might have, so if you can kind of, address some of those, give us an idea, perception. Some of us have different perceptions of what's happening. What should we do, and what can we? I think everybody said we want to help. Everybody's saying we want to do something. What can we do, and how can we help without really stepping on other people's toes, and doing this the right way? So over to you, Apurva ji.
Thank you. Namaskar to everybody. Thank you, Vijay, for such wonderful introduction, and thank you, Honorable Minister Anita Anand, if she is hearing it. The eminent panel which is present here today. So let me begin by thanking ICCC for inviting me for this very timely discussion. We are aware of the context. We heard Mr. Prime Minister through those message of helping out Minister Anita Anand of how about the vaccine friendship we have, and how Canada has been helping us out in this thing. So we are facing an unprecedented second wave or tsunami, as some people are saying, of this pandemic, and this has obviously put considerable pressure on our healthcare system, on the capacities and the resources that we have. While the government of India and state governments are working overtime to mobilize all resources to fight this unprecedented crisis, aircrafts and trains have been sent across the country with oxygen and materials. Industrial oxygen have been diverted toward medical needs. Domestic production is being ramped up. However, there's still shortfalls in some areas, and we have made quick assessment of our capacity shortage in short term. and have been trying to find the most effective means of addressing those resource constraints. So if today, to begin with, what are the shortages that we are facing? What are our priorities for India today? Today, we have liquid oxygen is one of the areas that has been a priority. We need requirements for equipments that produce oxygen generators, oxygen cylinder with 10 liters and 45 liters, liquid medical oxygen capacity, oxygen concentrators, cryogenic tankers, transportation equipment for oxygen, some ventilators. And there's also a need of pharma products like remdesivir and tocilizumab. So although we produce around 67,000 doses of remdesivir every day in India, but given the requirement, obviously the production has not been adequate to meet the immediate shortfall. Currently, the need is around 2 to 3 lakhs per day. So of course, we are working with our international partners to get the medicine very quickly into India. We have also been engaged in various commercial negotiations with companies across the world to procure these requirements on a commercial basis. And some of this is also government to government. But we have also been receiving overwhelming offers of support and solidarity from foreign governments who have come forward to extend help in these trying times. Over 40 countries have committed to provide us with many of the items that we need urgently, which I have already mentioned. And many of the supplies have already started coming in. And this support and solidarity for India has been very overwhelming and very touching for us. This kind of support we have also been seeing in Canada. This includes offers of support of $10 million to Canadian Red Cross by Prime Minister. Prime Minister Trudeau also expressed willingness, and we just heard Minister Anita Anand to provide extra medical supplies to help the country overcome the crisis. Foreign Minister of Canada spoke to our External Affairs Minister 3 days ago to convey Canada's solidarity with the people of India and expressed Canada's willingness to support India for meeting its urgent needs. So we are very grateful to the Canadian government and our friends, especially the Indo-Canadian community who has such, I have been speaking since I think last week to this few days. I have my throat is choking because I have been continuously on phone and people asking what we can do and how can we support, and the love for India. It's really been very emotional and overwhelming for all of us. And yesterday, as Vijay has just told you, the Niagara Falls lit in Indian tricolors to show the solidarity. So apart from, there's this government to government level, there's commercial, there is foreign governments who have coming out and helping us. There are many of the large Indian companies who are already very integrated into supply chain globally. They have been sourcing equipments. International companies have been offering, help both on commercial and assistance basis. The community organizations and individuals from all over the world, and you're coming together and saying what we can do to assist. In Canada, several organizations have been working towards meeting the requirements, and some of them I can see here. Ramesh Bhai has been instrumental in mobilizing the community together. So while we have been taking various steps to augment the medical supplies and equipment domestically as well as from across the world, we are still continuing to explore the options of importing on commercial basis. So if someone has leads for supply of these items and would want to do so on commercial basis, please write to us with specifications, with the cost and delivery into India. If you want more details, you can always write to us. If it is as a gift from foreign government or agencies, it has to be consigned to Indian Red Cross Society, which will receive this on behalf of Government of India. And we will facilitate the blanket custom exemptions, including IGST, NOC from other agencies, and quick clearance on arrival on consignment. So private donations routed through Indian Red Cross Society will also enjoy the same privilege. So any details, I think I have circulated it enough to major whoever has shown interest. But anything you need to ask, please feel free to write to me, and I'll be very happy to guide you in the same manner. So our objective is to ensure that, once we receive this in India, to channelize all of these commercial procurement and the assistance very quickly and effectively to ensure that we facilitate quick clearance, and that to ensure, most importantly, that all of this is taken to different part of the countries where it is most critically needed. So Ministry of Health, of course, in India has a full picture of where what equipment is needed where, and of course they do it very quickly through flights or trains or whatever, however, the best possible options. So we are working with governments, we are working with private sectors, we are working with associations, we are working with chambers of commerce. We are giving the top priority to meet our immediate short-term requirements in combating the second wave of COVID-19 pandemic. For the medium term, and these shortages are all short-term. For the medium term, we are trying to create our own capacities, of course. You have seen that when we had the first wave, there was a shortage of masks, PPEs, and ventilators. And then in a very short while, within the span of 3 to 4 months, we went from being a net importer to net exporter of these products. So we hope to see the same in terms of production of important pharma items, in terms of production of some oxygen generating equipments. We are all working towards it. And of course, I hope that we will be able to manage it very well. To conclude, our health system may have been stressed and overwhelmed, but we are fighting back with determination and stronger resolve. Hospitals and frontline doctors and medical staff have been working nonstop. None of the hospitals have closed. None of the doctors have stopped working. Rather, they are working extra time. So I just hope and pray that we will all get over this together very soon, especially with the support of all the friends here across the world, especially in Canada. So let me conclude here. Thank you for your time. Look forward to a positive and solution-oriented discussion. Thank you. Thank you so much.
Thank you very much, Apurvaji. I think that's it's fantastic. I mean, you've laid down the things that people can do. You're looking forward. I mean, there's also commercially, India is willing to buy these quantities. If any of you know where oxygen concentrators are available, please let the Consul General's office know. They will procure those things. They will make sure they send that to India. I think that's fantastic. If you guys want to do procure some on your own and gift them, that is also, I think, possible. All of these are going to be put through the Indian Red Cross, and the Canadian government has enabled the Canadian Red Cross to take these donations and back to back send it to the Indian Red Cross. So and if you do it in Canada, you also get a tax receipt in Canada. So any Canadians that are watching, that is what the Canadian government opened up. And also we have other people on other community organizations that have stepped up, and we'll get into those into a little more detail. At the Indo-Canada Chamber of Commerce, we have a list of organizations that can do this. But again, as Apurvaji mentioned, India needs oxygen concentrators. India needs some medicines. Those lists are also available on the Indo-Canada Chamber of Commerce website. If any of you do know of people that are willing to commercially sell that, please let us know as well. So I think that's the message from Apurvaji. Apurvaji, thank you very much for making time. We really appreciate it. If you can stay on, please do. I know, again, as I mentioned to Minister Anand, you've got a lot of stuff on your plate, so we don't want to hold you from other good stuff that you might be doing. But if you can, please stay. Thank you very much, Apurvaji. With that, we'd like to move to our panel. Our panel today is people that are definitely in the area doing a lot of stuff. We will start first. I'll go, Ramesh Bhai, if you're okay, I'm going to do a right to left. Okay, we're going to go right to left, and Sharanya Shekhar. So Sharanya, you're the director policy at Canadian Red Cross. You've been selected by the Canadian government to be the agency that is going to be taking in the $10 million that the Canadian government is giving, as well as possibly the money that the Canadian citizens are going to be putting in, and you're going to be sending it across to the Indian Red Cross. So do you want to throw some light on how this is all coming together? What is your perspective, and how what stage of readiness, or how is this working right now? So over to you, Sharanya, and if you want to give a little bit more introduction about yourself, please go so. But if you can keep it like between a couple of minutes, Over to you, Saranya.
Great. Thank you so much. Thank you for having me here. I am an Indo-Canadian, so I have been following this from a very personal standpoint, but here I'm today talking about my role at the Canadian Red Cross. And as mentioned, I'm the Director of Humanitarian Diplomacy or Advocacy and Policy. So just going back, I wanted to say that the Indian Red Cross and the Canadian Red Cross have worked together for many decades. So our collaboration in this response is not new, but rather a part of our historical precedent. We have, as a movement, Red Cross and Red Crescent movement, we come together all the time to support different national societies. Within the Red Cross movement, the Indian Red Cross is a big national society. It has a lot of capacity. It provides, even generally during, outside of a pandemic, it provides ambulances and all types of clinical health services. So when this happened, the Indian Red Cross was seen as the key actor that can help respond to COVID-19. And so what has happened is that the Red Cross and Red Crescent movement globally has tried to support where the needs are highest. And right now in India, we have seen a donation from the government of Canada for $10 million. This will be used by the Indian Red Cross to determine where they need it the most. So I already heard many needs that have been named, including actual supplies, but there's also an element that's going to be spent on communication, addressing rumors and fear among people who are worried about COVID or don't know what to do, providing basic hygiene items, especially to those who are really at risk, such as migrant workers, homeless people, etc. And so this is going to be ongoing. And right now they're planning in terms of what they need the most and where to put the funds. As also mentioned, Canadian citizens can donate to the Canadian Red Cross. We're on appeal. And these funds will be, as mentioned, sent to the Indian Red Cross, and it will be used again for their operation. Just to give you highlights in terms of what the Indian Red Cross has been doing, as I said, they already provide ambulance services, first aid. They have provided medical care and oxygen to those most effective. They've used volunteers to go out talking about hygiene promotion and rumors, provided logistical support to quarantine facilities, provided meals to homeless people, migrants, elderly people, and making sure they're also providing psychosocial support. So this is just a snapshot of all of the activities that the Indian Red Cross is doing. I think from the Red Cross global perspective, we know that this is a very acute emergency, but we have to be prepared for what might come next. And I think there was already a very good article that brought up that the three main things are really supporting local actors on the ground who are doing work. The Indian Red Cross is the best place to know where the needs are the highest. And we do want to make sure that the assistance is going to where the need is most acute. That's how you really bring down the emergency. Making sure we support vaccine equity so that everyone has access to the vaccine and dealing with any fear around that, and then working towards recovery and future epidemic prevention control. And this is something Red Cross works on.
Thank you, Saranya. We'll come back to you, but with that, I'll probably go to the people who are actually trying to do it. So Ramesh Bhai, we'll go to you next, and then we'll go to the to Ananya and Madhukar. So Ramesh Bhai, you are as part of Raj, and we at the Indo-Canadian Chamber of Commerce, we've been working with you closely. You put together a community effort to get 1,000 oxygen concentrators and send it to India. So do you want to give us a little bit of insight to where you are, how's it going, and how has the response been? I know some of these answers, but I think the rest of us here don't. So for the benefit of everybody, if you can please let us know. Over to you, Ramesh Bhai.
Namaste. We've been in it for now about over 72 hours. On Sunday morning, I sent 78 emails, and within a matter of 3-4 hours, we got a tremendous response that it was mind-boggling. We were asking for donation for the generators, oxygen generators for India. That's the project. And we indicated that, all the donors will receive a Canadian tax receipt. And we were asking for $320 per each generator. Within 4 hours, we reached 400 generators, including the donation from Vijay, the president of Chamber of Commerce. And we profoundly thank the Chamber of Commerce for taking a lead in this. Up till now, we have 1,700 generators fully committed. And then we approach each of the temples and the individuals. 160 generators have been committed by Pushti Marg Vaishnav Samaj, which is a small temple on Young and Clark. 120 has been committed by Mississauga Ram Mandir. 360 have been committed by Lions. 250 have been committed by Sanatan Mandir, that is on Woodbine. 200 plus have been committed by Vishnu Mandir, and Canada India Foundation has committed 50, but they will probably escalate to 200. So the response has been phenomenal, right from Montreal to Vancouver. And even somebody in Goose Bay contributed. So this has taken off like a wildfire. Now, having done this, and the pledges are pouring in at an alarming rate, we had to secure the supply. On Sunday, we got hold of the Taiwanese, South Korean, and Chinese suppliers. The price quoted was $320. This morning, they escalated the price to $600. So there is a global demand. The demand is soaring, and we are up against grabbing the supplies. So we have been able to get about 1,000 oxygenators, 5 liter, 10 liter, 12, 18 liters. These are 10 to 18 liters will be supplied to the hospital. The others will be for household purposes. Now, having done that, we had a distribution problem, because the transportation system and the supply chain in India has virtually crashed. Even to transport something from one state to another is a problem. Our first landing will be of about 1,000 oxygenators will be on Thursday or Friday. And they will be distributed in Rajasthan, Gujarat, and then following week, there will be another 1,000 going. Our target is to get 5,000 generators sent to India. Apurvaji has been very kind and been working with us. So if once they land in New Delhi, we are working with Indian Red Cross to ensure that these are supplied to the needy hospitals, because Indian Red Cross has assured us that they will make sure that this goes to the hospital, and they will provide us the manifest as to which hospital they've gone. Because this is, the Canadians across the land have donated. So it is just not going to Gujarat or Punjab or anywhere. It is going from Kashmir to Kanyakumari. We want to cover as many states as possible, and also wider distribution is our aim. And each generators will be marked gift from Indo-Canadians. This will be embossed on the generators. So this is something that we are working on. We are working very diligently. In fact, I got some good news as well, that we were talking to the Gilead, the manufacturers of Remdesivir, and there is Remdesivir of 400,000, 4.5 will be landing in India on Friday at 1:30 p.m. And this will be received by the Minister of Health in Delhi. So there are various fronts that we are working on, and US donors have committed 50,000 US dollars to this project. It is just gone out, it's like a wildfire. Everyone is donating.
Ramesh bhai, I'll have to stop you there. We have a more panel, but thank you very much. You're doing fantastic work. That's really good news. Remdesivir from Gilead is going to India, going to land there. Thank you. We'll find time to come back to you. But with that, I'd like to move to Kanchan Kumar. Now, Kanchan has done something on his own. He and a couple of startups. I know Kanchan from Thai Toronto. We were on the board of Thai Toronto, and he. So you've taken a different route on this from Ramesh bhai. Kanchan, if you can quickly tell us what you're doing differently, and how is it that you, and I think you have some good news to tell us as well. So over to you, Kanchan.
Thank you, everyone, for being here and doing everything that we can do for India. And thank you, Vijay, for having me here. What we're really doing is taking a very different approach, which is a lot more individual-driven small donors coming together. It all started on Sunday when I think several of our friends and family got together, and we figured that there is a massive shortages in smaller towns and cities, which are not even making it to headlines, because obviously the larger cities have got a bigger problem. And we said, how do we solve that problem? Was that we had some funds that we had committed for the purpose, we diverted it. And there were few of our startup friends had gotten together, and they were ordering a 10,000 batch, literally a plane load, which was coming there. And we, in the last minute, we managed to push our order through them. One such, and possibly I can share a picture sometime, landed here. What we're doing now, and then that is where it all started. And one of the bigger problem that we saw was, how do we really collect and ensure that we create a very trackable mechanism for small donors to make an impact. I'm deeply embedded in India startup ecosystem, deeply embedded in the Bay Area US startup ecosystem, and of course I'm here in Canada. And what I really did was that put together a web page, indiao2.org, in indiao2.org. You can go and check. And we create a mechanism that you can do a simple e-transfer. You can use PayPal to send money. People have been donating anywhere between $1 to $1,000. It doesn't matter who donates how much. It's the emotion behind that. And what is most heartwarming is that there are 30% of these donations are coming from people who possibly have no connect with India at all, except that they may have a couple of Indian friends. It just shows the goodness which is there in this world that we want to harvest and channel it for the right cause. We're just placing another order that we secured enough funding from these fresh donations, another set of order today. With, again, there's another large batch of 10,000 orders which is being placed. We have placed our order as well. 1,000 orders mid-May that should get to India. What we're trying to do now is to create a crowdsourced database, mostly from donors itself, that most of the donors have their hometowns and family back home, and they can tell you where exactly is the issue. So there is someone from the Trichy who comes back and tells you, here's a problem in the Trichy. We have a colleague, I mean, that's where it all started. We have a colleague whose parents were in Varanasi, and they were struggling to find oxygen, and that's where the whole thing started as to how could we do that. And there are so many such situations which typically when you have a large scale effort, it gets missed out. It falls through the crack. What we are really trying to do is to create a mechanism where it goes to the last people, last small hospital in a village. And we are creating an effort to, by the time we have the next batch coming in, we would have a large database, which is crowdsourced with our team working together in India right now. Most of volunteers, crowdsourcing and vetting, calling them to understand which hospital where needs what, so that it's not just oxygen O2 concentrators today, and not just for Delhi and Mumbai right now, but the fact is that Delhi, Mumbai is what we know is here today. A week down the line, there are places which are most likely to see surge coming in. What will happen there? 2 weeks down the line, there'll be something else which will be needed. We don't know yet. And we have to go back and listen to the doctors on ground in hospitals which are working there. So what we're really trying to do here is to create a map, database of hospitals and a map of who needs what where, and then which is on the demand side there, on the supply side here, trying to put donors and trying to take our small orders into larger batches with larger foundations are ordering and push it there so that it reaches there in time and we don't have to pay high prices for the same orders. It's not tax deductible. It's not a charity organization. It is just set of individuals coming together and pooling money. As of right now, we have $75,000 we've collected in the past 3 days.
And Kanchan, you had some oxygen concentrators that made it today or yesterday, or can you just elaborate a little bit on that?
That's right. So the first batch that we had placed even before we started, which was 100 oxygen concentrators of 10 LPM, that has landed today. And that's good news. Now we are
that is very good news. I mean, unfortunately, we can't clap here, but that is fantastic news. So congratulations to you and your group for actually getting stuff on the ground. So fantastic work there, Kanchan. So Kanchan, I'll have to cut you there. We've got to go through the rest of the thing, but here's a different take on it. You unfortunately do not offer any tax benefits, but any of you want to, Kanchan, if you can later on go to Facebook and give the details of your group as well, or any of you that are watching on ATN, or if any of you are watching on Zoom, please put in your questions on Facebook Live. Put in your questions. I would request our panelists, if the questions are for you, if you can look for them and answer them, or we will try to do that. So please, the audience, please ask your questions. So with that, I'd like to move to now the next section of people that we have. We have people from McGill and Ananya Banerjee. I am really sorry. We put you as University of Toronto, but you're from McGill. But you've got some University of Toronto background, I think. So we've kind of got a little confused there. But we'll start with you, Madhukar. We'll keep the best for the last. We'll start with you, Ananya. You wrote an article in the Globe and Mail recently, and it talks about how Canada should do more, right? I mean, I think you're already hearing what the rest of the panel says. There is a lot being done. You heard what Apurvaji mentioned about India, being able to actually buy all these things as well. So there's none of it available right now. So what do you think, when you say Canada can do more, what can we do? The whole world is under, COVID, right? It's not that we're not in trouble ourselves, right? It's not that, we can do. So what is it that, your take on it, and what do you think the Indo-Canadians, there's no travel right now, given everything that we have. And this is looking forward. I mean, there's things that we could have done in the past. We're not doing that, but with a very positive looking forward perspective, glass half full perspective, what can we do to help, and your perspective there? Ananya, over to you.
Thank you. I really appreciate you reading the Globe and Mail article. And so that was really in response to the frustration that many of us felt when the Trudeau government, instantly first put the travel ban, but was not thinking, obviously, as a priority, how to support India as an impending crisis has begun. I think what's been really also frustrating is the fact that they said they were ready to assist and that they were on standby. And again, clearly showing that India is not on priority and not understanding the dire situation that is happening. And I think it's after much public pressure from myself, Madhu, and many of us through our, op-eds that finally quickly an announcement had come out from Anita Anand saying, okay, we're now ready to give $10 million. And given the situation in India and understanding it's going to be a multi-billionaire effort to really have India recover from this. And, this is not even the worst yet. They're predicting by mid-May, there's going to be 13,000 deaths per week. And it's really, unless we mass vaccinate the entire India population, that they're not going to be able to get through the second wave. And one of the dangerous parts is the fact that there's going to be new variants also emerging. And who's going to be impacted the most? Those in India, even before us. And so obviously Canada is clearly trying to protect themselves more than India, which is hard to digest given that there is more than 1 million of us and we have such strong economic and strategic ties and we have sacrificed so much to boost Canada's economy and we are taxpayers, and so we fully deserve better from Canada, and $10 million is nothing. It's not going to get us far, and I don't think we have to shoulder the responsibility among all of us from the Indian diaspora to help stop the fire in India, and we need to put more public pressure on the Canadian government. We need them to be transparent in terms of where is this $10 million going to? What is it going towards to? What are the outcomes as a result of, whatever they are sending to? But what is more going to be done? Because this is going to get worse and worse as the weeks to come. And they need to be starting to get engaged from now until this is over. So this is something that I really wanted to really focus on. I think as Indo-Canadians, we need to band together. And I think it's great that all of us here are doing our own work, but we're all working in silos, and it's really frustrating that we haven't been working together. We're not aware of these efforts because it's very fragmented. We need to come together and understand how much money we pooled, what are the resources we're sending, and we need to send that to the government and show them, look, we are actually investing more in India compared to our own government. Can you match this, right? Or even further. So I don't think we should applaud the Canadian government. I'll be honest, I don't think we should applaud our communities yet also. It's too early to say what's to come and what is absolutely needed. And I think first what we need, and I don't think there's enough awareness among Indo-Canadians. I think many of us are living in a bubble because we are in this space and we're dedicated to this work. And so I think there's just a lot of work to be done, increasing awareness about ourselves, coming together and working together, and most importantly, putting pressure on the Canadian government. I won't get into the patent issue because I think that's something Madhu will be able to talk about. And actually would love for Madhu to continue the conversation because I really feel both of us are here together today.
Thank you very much, Ananya. That really, is a different perspective again, based on as the president of Indo-Canada Chamber of Commerce. There is so many different perspectives on this issue, and that's why when I started off, and I was speaking to Kanchan as well, there is different perspectives on this issue, and Kanchan agreed. On his website, there are people that have come up to him and said, why are you raising things for India? India does not need this. Okay, so there is people in India themselves that are saying, so there is a political problem here as well, that we had to, when I put together this event, there were people that called me and said, why are you putting this event up? Okay, so at some level, Ananya, what you're saying does make sense, but I think there is an awareness, and that's why I said the tone of today's thing is this camaraderie. We are here to help each other. These are two friendly nations that help each other. When Canada asked India to help us with the vaccines, it was not a sign of weakness of Canada. We went to India, we asked for help, India did help us. And if this happens, vice versa, but there is a perception in some quarters that this might be so. So yes, point well taken. And I think, being where we are, there is a counter to that as well. But I think, the dust has to settle. And I think people have to look at this from a global perspective. It is not nationalist, because, we've got to look at it globally. We're all a global village. So I think, in that sense, definitely, are we there yet? We are not. With that, let's move to the last panelist that has not had a word in as yet, Professor Madhukar Pai. Professor Madhukar Pai, those of you who've been following this, you might have been forwarding an article in Forbes magazine, Forbes.com, which says, I think Canada has to do more for India. By the way, the author of that article was Professor Madhukar Pai. So we really have the honor and privilege of having him here Professor Madhukar, or he likes to be known as Madhu. Over to you, Madhu. And again, if we can just keep it to what can be done, I know lots, could have been done in the past, but what can we do going forward? Over to you, Madhu.
Thank you, Vijay, and thanks, everyone. I want to begin as an infectious disease epidemiologist and a doctor and a public health person to try and convey to all of you the scale of the problem we're looking at. Because if we don't understand the scale, we don't understand what our response should look like. We will, in a few days, hit 500,000 cases a day. And that is seriously undercounted. Okay, the whole world agrees that India is underestimating. And why is that? My own friends and relatives cannot get a test right now for COVID. I have not been, as a doctor, able to get a COVID test for my own friends and family. Hundreds and thousands of people are getting symptoms and not even getting tested. So if you really count the numbers, we're looking at a catastrophic event. No health system on the planet can deal with this deluge of cases. The estimate currently is that by mid-May next month, India will need 350,000 ICU beds. Okay, 350,000. Our current ICU beds in the country is 95,000. We will need 700,000 ventilators. Currently, we have 48,000 ventilators in the country. We're not even talking about rural India, friends. Rural India is a whole another situation where there is nothing available, okay? To recover from this level of calamity will require billions and multiples of billions of dollars. And I cannot imagine how we can all stand by and allow this to happen and not contribute. This is what we were all working and earning money for. We have to help India, whether India invites us or not. You don't need an invitation to save your own motherland. Please try and understand that. I don't care what anyone in India is saying or not saying, I'm going to help because I have to. You have to. We have to. And we have to band together to do it. Individually, we are doing it. Ananya and I waited for nobody's permission to write op-eds, to donate money. I've already donated money every single day, and I'm tweeting others to donate. I've donated to the Canadian Red Cross. I've donated to the American Indian Foundation. I'm not waiting, I'm doing it. But we got to do more than that. 10 million for me from the Canadian government is a drop in the bucket. It is not even something we should be proud of or tweeting or even mentioning. US has already announced 100 million, and that is just the start by the Biden administration. If there are 1 million of us in Canada, Indo-Canadians, if each of us gave $100, which is peanuts, we are already talking about 100 million contribution to India, which should be the rock bottom, in my opinion. That is the level of ambition we need because the scale of need is enormous. Okay, no words can even convey to you how catastrophic the situation is for India. This is where the country is sinking. We need to save it. So that's one thing. Please ask Canadian government to do more. 10 million is nothing as far as I'm concerned. We've got to do better than that. The next issue I want to say is all Indo-Canadians like us must do more than what we've done so far. We've been silent. We've been doing tiny little things on our own. We got to band together and say, we have 100 million campaign to donate to Canada. Here is how we do it. And here is how we'll channel it. And then Indo-Canadian Chamber of Commerce is well placed to bring us together. We need a common platform. The last comment I'll make is our non-Indo-Canadians, there are millions of us in Canada. Please talk to your friends, your Canadian neighbors, and tell them how catastrophic this is and have them donate. Many of them ask me, where should I donate? I'm now directing them to the Red Cross, right? The Canadian Red Cross. Find a way to raise awareness of the scale of the problem so that the contribution is not just 1 million of us, but 40 million Canadians contribute. Thank you.
Fantastic, Madhukar. I think that is I think what we wanted to achieve today is if you want to help, you help. You don't wait for people to say we need help, and I think you've gone ahead and done that. And as the Indo-Canada Chamber of Commerce, this is something that we've started doing. We're putting together people together, and that was the effort at getting everybody together. all of us, that's why we've got people that are doing it on their own, going after tier 2, tier 3 cities. Ramesh Bhai and Vraj, they're going after 5,000 machines. So I think we're all putting this together. I think, listening to everything that you've said, I think here is an opportunity for us. We would like to, get all of you together, create a committee, a task team to go after this, and all of you on the panel, I am not going to ask you your permission. You're all on the panel. You're on our task force. We're going to go after this, and absolutely, I think we will get people's support. And having said that, I'd like to just go through with all of you and ask you one quick question. If that you might think, I think that the thing here is, what would you want to tell Indo-Canadians, and what did you want to tell Canadians? Let's start with you, Ramesh Bhai. What is your advice to Indo-Canadians and maybe through them to Canadians, or what would you tell them?
We like to appeal to all Indo-Canadians, like Madhu mentioned, that to donate to the cause. We will ensure that the equipments are delivered there without any cost attached to that. We want to see that we do more than 5,000 generators. We have already surpassed about 1,800 within last 96 hours. And we are trying to secure the supplies to Taiwan, South Korea, China. But the global market is under dire stress, and the prices are increasing day by day. But we appeal to the community to donate freely, because India is in dire stress. This is the most tragic moment that India is going through.
Thank you, Ramesh Bhai. Sharonia, a quick thing from you to Indo-Canadians as a fellow Indo-Canadian, and to Canadians as a whole.
I just want to say it really struck home when I heard the figures that Madhukar just presented. And the problem is there isn't that awareness of how dire, things are. I think it's overwhelming for people to know, especially non-Indo-Canadians who are not following this, to know the scale and the scope of this problem and why we are raising such a huge alarm. That, we know that COVID has spread in many parts of the world, but why is this so alarming? And I think that is what we have to continually be raising awareness, because as it was already mentioned, this is only the start. It is only predicted to actually increase in terms of needs. And so I think it is a really sustained effort, because right now it's in the news, but it could very easily disappear from view. And so I think there needs to be a sustained effort to keep it in the awareness of people, so we have that drive to help and donate, and really contextualizing how serious the humanitarian needs are. I again heard that we don't even talk about the rural situation. There is a really big issue that's going on with migrant workers that have come into the cities and going home, and we know it is probably so much more than what is being talked about. So I think that's a really important role. Thank you.
Thank you, Sharonia. Kanchan, if you want to, what would be your message to Indo-Canadians and Canadians as large?
I must say that I'm really happy to see here everyone making an appeal. What is most important is to convey and alleviate any fears about where the money is going to go. Right now, the place that India is in, no money is less. Even if you're contributing $10, that what you can afford, it's not less, believe me. It means something to someone in India. It can save life. No money is more. If you're donating $1 million, that's not, it's still a drop in the ocean, like Madhu mentioned. But most important, I, along with the technology entrepreneurs that we have, and large part Indian entrepreneurs, we are putting together an infrastructure in place for it to reach, so that there's not a single hospital, even in a rural area, is left behind. And that's most important. Because many of us come from small towns and villages. You just have to make a phone call and see what's happening there. You don't need to read newspaper there, right? And we need to ensure that change happens there and the relief reaches there. And that's what we will do it. That's what is my promise. Thank you.
Thank you, Kanchan. Ananya, if you want to, your message to Indo-Canadians and Canadians.
So I support everything that the panelists have said so far. So I am going to bring a different message. And my message is for those who are reluctant to help India right now because of the political nature of the pandemic in India. And I'm really encouraging all of you to please put politics aside and do not blame India as a country for this pandemic. It is a result of systemic failure and poor governance. And so because of the systems that Indians live in, they should not be punished and have to needlessly die as a result of this pandemic. And every effort that we are putting into every individual in India, 1.4 billion people who are at risk for dying any moment right now. And so I'm urging, please, please do this for the country and its citizens and just take the politics aside.
Thank you very much, Ananya. That's a very passionate appeal, and I think you and Madhukar, and that's why I leave the best for the last. Madhukar, if you want to add anything to your previous comments, last words from you.
I think not just our mother is in trouble, but all our brothers and sisters in the Indian subcontinent are in trouble. If you have not seen it, it is the scariest graph to see. India's graph is looking vertical. Pakistan's graph is looking vertical. Nepal's graph is looking vertical. Sri Lanka's graph is looking vertical. This is no longer an India problem. The entire Indian subcontinent was seeing a massive resurgence of COVID-19 driven by the new variants. And this is a huge lesson for all of us. We cannot think of this pandemic as just India, just Pakistan, just Nepal. Every one of us is at risk. Just as when Brazil did not contain the pandemic, all of South Africa is suffering. US did not contain the pandemic, entire North American continent is suffering. We got to end this pandemic everywhere for all of us to feel safe. Just because you and I are lucky enough to get vaccinated in this country doesn't mean we are safe from this pandemic. How long are we going to keep our borders closed? How? How many years, months? What happens to our economy? When do we get to travel to India again? We've got to end this pandemic for the whole world. That means vaccines have to reach every last person on this planet, all 7.5 billion people. Only then will this virus go. And that means we have to advocate with our government, for every government, for vaccine equity. It is not just rich people in Canada and US getting vaccinated and being happy about it. We can never be happy if the rest of the world is burning. We've got to nail this virus. Otherwise, we are playing whack-a-mole with this virus, country after country after country, and new variants will come here, as they did. The Indian variant is in Ontario, is in Quebec, is in BC. It's in California, it's in London. We cannot control this virus by just thinking about our backyards. We've got to think of a global solution. That means every last person on the planet should get the vaccines that they deserve. Otherwise, we are in this eternal cycle of lockdown and release and lockdown and release, and the economy will be in shambles forever. This is a crisis for humanity to solve, not just Canada's problem or India's problem. I have a piece coming out in Washington Post tomorrow, which I will forward to all of you. And I'm arguing that intellectual property, patents, tech transfer, everything has to be liberalized. Every country should be given a vaccine recipe, should make. Otherwise, we are dependent on 1 or 2 or 3 companies. There'll never be enough vaccine for 7.5 billion people. That's my appeal. Fight for vaccine equity, because you and I have to get out of this mess as much as India needs to, or Pakistan needs to, or Bangladesh needs to. Thank you.
Fantastic. I think on that note, we've got to call this an end. We only have so much time today, but thank you very much, everybody, for joining in. Thank you very much to our fantastic panel for making time. I think the closing words there, this is not a country thing. This is a world issue. We should all look at this from a global lens, and everybody that's joined in, thank you very much. We have a few messages for our sponsors. We just want to thank our sponsors. Turkish Airways Airlines, our sector sponsor, SBI Canada Bank, ICCC Canada Bank, Raymond James, Seneca, GT20, TELUS Business. We also like to thank, moving on, our technology partner Tangentia, branding partner Branding, media partners Weekly Voice, PTC Punjabi, and our brand new media partner ATN, who's carrying this live as we speak. With that, I'd like to thank everybody for attending. We have Thursday talks every Thursday, 4:30. I'm pretty sure we will have all of you on the panel back again sometime soon, and we will create a task force, as Dr. Madhukar Pai mentioned. We will take the lead at the Indo-Canada Chamber of Commerce, get all of you together, and we will take this forward. So thanks again, everybody, for joining in, and thank you very much to the panel for making time. Thank you, everybody. Have a nice one.